Hello and welcome to Fraser Health Online Cardiac Rehab Education Program. My name is Monika and I'm one of the exercise specialists with Fraser Health. This is one of the 8 presentations offered by Fraser Health for online learning. The topic for today is exercise and the heart. This presentation should be used for information purposes only. The content should not be considered as medical advice, or should it be used as such for specific medical opinions. Please consult your healthcare provider. The objectives for this talk are physical activity versus exercise, the benefits of exercise, the importance of warm-up and cool-down, and the rating of perceived exertion scale, and the target zone. Exercise prescription and considerations, how to know if you're overdoing it, Nitro Spray, environmental considerations, and some strategies on how to get you started and to maintain an active lifestyle. Physical activity versus exercise. So there is a difference between physical activity and exercise. They are not the same. Physical activity is any body movement that increases energy expenditure. Think of it as activities of daily living. For example, it includes gardening, housework, duties around your workplace. Whereas exercise is a planned, structured, repetitive, targeted activity to improve and increase fitness. Some examples include walking, biking, and swimming. There are many benefits to exercise, and it all impacts risk factors. So exercise can improve the health of your heart. It decreases the blood pressure and heart rate at rest. It makes your heart pump stronger so that it improves the ability and the efficiency of the heart to pump the blood throughout the body. Exercise improves lipid profiles, so it lowers the triglycerides and increases the good fats, also known as high-density lipoproteins, HDL for short. Okay. It has positive effects on musculoskeletal health. It keeps the bones strong and decreases the risk of osteoporosis. It helps with posture, balance, flexibility, fall prevention. With regular exercise, it can increase the strength and the function of the muscles so that you can perform regular activities of daily living with ease, so that you can lift the groceries back home without effort. You can play with your children, your grandchildren, at the playground with energy and endurance. With continued exercise, it can also improve the muscles that help you breathe, so your inspiration and expiration muscle. And then this all ties into improving mental health. So exercise enhances the sense of well-being, self-confidence, self-efficacy, and independence. It reduces stress, anxiety, and may help with depression. It can also help you improve the quality of your sleep. Exercise can improve control of blood sugar levels. It helps increase the muscle sensitivity to insulin and reduces the need for insulin, because during exercise, blood sugars are one form of energy your body uses. And exercise can also help with weight management. So it is important to warm up before an exercise session or activity session. So warm up gradually increases blood flow and heart rate. It increases the efficiency of oxygen being delivered to your working muscles. Warm up also gradually increases the deep muscle temperature. It also improves communication between the muscle and the brain, and also psychological preparation. Essentially, it prepares your body and mind for exercise. Warm-up should be included at the beginning of each exercise session. A minimum of 5 to 10 minutes of gradually building activity is recommended. So perform movements that require full range of motion, coordination, lots of dynamic movements. So imagine if you're in a personal bubble that's moving. So you're trying to reach that personal bubble 360 degree. So some movements that you can perform may be swimming in the air, performing Superman, soccer kick. You can also include marching into the mix. Cool down is also important. Cool down gradually decreases the body temperature back down to resting levels. It gradually decreases the heart rate and blood pressure. It also prevents pulling of the blood towards the feet, a phenomenon also known as venous pooling, which can lead to lightheadedness and fainting. Cool down may reduce possibility of disturbances in the heart rhythm as well. For the cool down segment, a minimum of 5 to 10 minutes of gradually decreasing activity is recommended. As well, incorporate flexibility, balance exercises as part of your cool down session. Next, I'm going to introduce you to the RPE scale. It is a rating of perceived exertion scale. It is a scale from 0 to 10 that tells us how hard are you working. So during your warm-up phase, you should be at an RPE of 2, a light. You should feel as if it's a stroll in the park, you're not doing too much, you're just walking across the lawn, your breathing is starting to get a little heavy, okay? So all the way to, during your peak exercise, all the way to a 3 to a 5, which is moderate to heavy, okay? So RPE of 3, you should be able to still carry on the conversation without feeling shortness of breath. All the way up to RPE of 5, where you can still converse, but your breathing is starting to get heavy. But it takes effort to talk, okay? But you are not struggling to breathe. A good method to test yourself is ask yourself, okay, let's recite the alphabet from A to Z. And if you could do that comfortably, then you're in a good place. So this graph is an example of a 30 to 60 minute cardio exercise session. So on the right side of the graph, going upward, represents your heart rate. At the bottom there, going towards the right, represent the minutes of exercise. Now looking at the lines, the first sloping going up, 5 to 10 minutes represents your warm-up, slow at an RPE of 2, which is a light. And then the second line there is your peak exercise. So this peak exercise here, realistically, it might go up and down, but for simplicity of this talk, we've drawn a straight line across. Okay, so for that represents around 20 to 40 minutes of exercise at a brisk pace, RPE of 3 to a 5. And lastly, the slope going downward represents your cool down phase, about 5 to 10 minutes, RPE of 2 at a slow pace. Okay, so think of cool down like a warm up but backwards. There are 3 different types of exercise: cardiovascular endurance, muscular strength and endurance, and flexibility. When starting an exercise program, there are many things to consider. So of course there's medical history, there's musculoskeletal limitations, accessibility, etc. One tool I do want to highlight here is the FITT principle. It stands for F-I-T-T. So frequency, how often should I exercise for? Intensity, how hard should I exercise for? T for time, how long or the duration of the activity? T for type, what activity or movement or exercise should I do to improve that part of fitness? Okay. We also want to consider the volume, the amount of exercise, and the progression, the advancement. How can I progress myself in this exercise or activity program? So the cardiovascular FITT principle. What can I do to improve the health of my heart and my blood vessels? Let's consider the FITT principle here. So frequency, ideally you want to exercise for 3 to most days of the week. Of course, having said that, if you have not been exercising for a long while or you've been sedentary, start off with 2 days a week and progress yourself to get there. Intensity can be monitored using heart rate, assuming that if there's a target heart rate available to you, please speak to your healthcare provider, case manager, or exercise specialist for details. So RPE for the intensity of 3 to 5 during peak exercise, moderate to heavy. You should be somewhat able to sing, you should be able to talk, and looking at your physical appearance, it should be pretty pretty good, okay? So time. So 20 to 60 minutes is recommended. Of course, having said that, if you have been sedentary for a while, start off with 10-minute bouts and then work your way up to 20 to 60 minutes. So the type of exercise to improve your cardiovascular fitness would be an activity that is continuous and rhythmic, involving large muscle groups. Okay. So for example, it might be walking, swimming, biking. Okay. For progression, consider your tolerance level. Look at your training history, okay, and look at your response to exercise. And if you're doing well, then you can progress yourself accordingly. Resistance training FITT principle, also referred to as the weight training, So what can I do to improve my muscle strength and endurance? Frequency. Resistance training should be performed about 2 to 3 days a week. The reason that you don't want to resistance train the same muscle group daily is because you want to give your muscle 1 to 2 days break in between to recover. Intensity level. You want to work at an RPE of 2 to 4 when you're resistance training. So it is a light to somewhat heavy, but it's effort without straining. The time would be more like counting the reps and the sets. So 10 repetition to 15 repetition of approximately 8 to 10 exercises. Start with 1 set. See how you do. If you're comfortable with the weight, if you have mastered the technique and the tempo, progress to 2 to 4 sets. The type of resistance training you should perform, try to start off with larger muscle groups first and then train the smaller muscle group. Another way to think about it is perform multi-jointed exercises and then to single-jointed exercises if possible. There are many equipment out there, so you can use machine weights for weight training, you can use free weights, rubber tubing, exercise ball, you can also use your body weight. Here are some key points for resistance training. So resistance training can be performed after a warm-up or a cardio session. Focus on proper breathing form and technique. There's mirrors all around the gym. Try to use those mirrors to check out your form if you need to. Okay. Avoid tight gripping because when you grip really tight on the weights, your blood pressure can naturally go up. Use controlled movements. Okay, so for example, if you're performing a bicep curl, you'll go up, 1, 2, down slow, 1, 2, 3, 4. Practice proper breathing technique. Okay, so whenever you're pushing, pulling, lifting, you're going to want to breathe out. Avoid holding your breath and contracting your muscles at the same time, which is known as Valsalva maneuver. Okay, so what happens when you do that is the internal pressure goes up, and then there's a rapid, large increase and decrease in blood pressure that can cause damage to either the blood vessels, such as the eye. It may cause arrhythmia in the heart, and it could also cause fainting. Flexibility FITT principle. So what can I do to improve my range of motion and my body to be more flexible? So frequency. Flexibility exercises should be ideally performed 2 to most days of the week. Intensity. Try to hold the stretch to a comfortable tension. Time, 30 to 60 seconds, about 2 to 4 sets ideally. Type. Static stretches. So static stretches are stretches without movement. Okay? And keep in mind that stretching is most effective when muscles are warmed. So it is a good idea to stretch anytime after a warm-up or towards the end of your exercise session. It is also a good idea to incorporate your stretching routine into each exercise session. Special considerations. If you have had an open heart or valve replacement, practice sternal precautions. So sternal healing takes about 8 to 12 weeks, and it varies among individuals. Keep an eye out for sternal instability, such as movement to the sternum, pain, clicking, popping, cracking, Okay? And avoid tension to the sternum. It is advisable if you feel any pulling to the incision or the mild pain to the sternum area to limit yourself to just range of motion. Okay? Also keep an eye out for any open wounds to the incision and harvest sites. Stenting, stents. So once again, assess open wounds. Are there any pains to the incision sites? Okay. Light resistance training can be started as early as 3 weeks post-procedure. Pacemaker and ICD implant. For 3 to 4 weeks after implementation, avoid rigorous upper extremity activities and avoid lifting arms above the shoulders to prevent dislodging of the device. Stay 10 beats per minute below shock threshold, so activation threshold, if it is known. Pulmonary disease. Consider intermittent bouts of exercise. So what I mean by intermittent is you can perform 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes in the early evening. Okay? And interval training is another option. So 2 minutes brisk, 1 minute slow pace, 2 minutes brisk. Okay? And then so on. Focus on strengthening the muscles that work the upper body to improve the efficiency of the inspiration and expiration muscles, which will help you breathe a little bit easier. If you have asthma, and if you're prescribed an inhaler, ask your healthcare provider if you can use inhaler to prevent or reduce symptoms prior to exercising. Peripheral artery disease. Perform interval training with rest phases if you need. Work to rest ratio will vary among individuals. Assess the pain threshold and work below that pain threshold. So you're walking, and all of a sudden you feel a little bit of cramping towards your leg. And then someone goes, oh, look, bird, and you're able to be distracted from that pain, then you can continue to walk. So weight-bearing exercises and non-weight-bearing exercises are recommended. Okay? So for example, cardio weight-bearing exercises include walking, stair climbing, and non-weight-bearing exercises include biking, rowing. Okay? A good option also is to alternate between weight-bearing exercises to non-weight-bearing exercises. So you could perform treadmill and then bike, treadmill, bike. So that would be an option. Diabetes. If you're diabetic and if you have severe retinopathy, avoid rigorous exercise and resistance training. Monitor for signs and symptoms of low sugar. So the exercise range is from 5.0 low, okay, to 16.7 high. And exercising right before bedtime and during peak insulin activity is not recommended for diabetics. So if you exercise right before bedtime, what may happen is that blood sugars can continually drop in your sleep. So avoid injecting insulin in working muscles. For individuals with peripheral neuropathy, which is the damage of the peripheral nerves that often causes pain or weakness, numbness to the hands and the feet, it can also occur in other parts of the body. So in this case, aim to prevent blisters, and ulcers. Monitor also for blisters and ulcers. Atrial fibrillation. So if you have atrial fibrillation, use rating of perceived exertion because target heart rate will not apply to you. If you have stable angina, stay 10 beats below the onset of symptoms. And talk to your healthcare provider, case manager, and exercise specialist if pre-nitroing prior to exercise is recommended for you. And if you have further questions, please refer to your healthcare provider, case manager, exercise specialist for exercise prescription and recommendations that are specific for you. So balance exercise should be incorporated into your workouts. So balance is a part of fall prevention because falls can lead to injuries and which can lead to limited movement and then sedentary lifestyle, which can then cause further health issues. It's almost like a snowball effect. Balance training strengthens the leg muscles and improves your stability. Please refer to the exercise video for specific resistance training, flexibility, and balance exercises. Signs of overexertion. Are you overdoing it? Okay. So pay attention to pain to the chest, back, neck, or jaw, shortness of breath, racing heart or fluttering sensation, sudden pain to the arm or the leg, dizziness or faintness, nausea or vomiting, excessive sweating. So it's normal to sweat during exercise, but if it's just more than what your usual is, then it's not normal, right? So intense fatigue and confusion is another factor to look out for. Just in case of emergency, how to use Nitro Spray. So if you're experiencing angina during exercise, you want to stop and rest for 5 minutes. If the pain does not go away, you want to sit down or lay down. Use one spray of nitro and wait for 5 minutes. If the pain is still there, still persisting, take the second spray and call 911. So once again, sit or lay down when using your Nitro Spray for your safety. When to defer exercise. Okay, so follow up with your healthcare provider if you're experiencing illness or fever, new onset of angina, uncontrolled heartbeat or arrhythmia, new onset, or if your medication is ineffective in controlling the heart rate. Okay. Musculoskeletal problems that worsens with exercise, present of signs and symptoms of overexertion, recent hospitalization without consent from your doctor to resume exercise, symptomatic low sugars of 5.0, and then sugars above 16.7, uncontrolled resting heart rate above 100 beats per minute, symptomatic low heart rate. So if you're feeling weak or generally unwell, symptomatic low blood pressure, if you're feeling lightheaded, faint, and generally unwell, high blood pressure of 200 systolic over 110 diastolic. And of course, keep in mind that heart rate and blood pressure varies from one individual to another. Physical activity in warm weather. So dress for the weather. So for example, in breathable clothing. Stay well hydrated. Add rest periods if you need. Adjust your exercise intensity accordingly. And consider the time of day, perhaps in the morning to avoid the hottest time of day. Physical activity in cold weather. And again, dress for the weather. Dress in layers, so if you say are out and you're getting hot, you can just peel off that layer. Light scarf if you need it. Change out of wet clothing. Wear appropriate footwear. So for example, if it's snowing or raining outside, waterproof footwear might be an option. Adjust your intensity settings accordingly. Okay? So a good example is walking in packed or soft snow. So it is harder to walk in packed or soft snow compared to walking on a solid surface. It requires more energy, so then this increases oxygen demands to the heart, meaning there's more stress put on the heart. So therefore, it is a good idea to consider slowing down the walking pace. Ensure proper warm-up. Now, a good example is shoveling snow. So we often underestimate how hard it is to shovel snow. The heart is already stressed from the cold air, okay, and then shoveling snow adds on more stress to the heart. This raising the heart rate and blood pressure even more, so that it increases the potential risk for a heart attack. If you really must shovel snow, okay, here are some tips. So make sure you warm up. Try pushing the snow instead of putting the snow onto the shovel and lifting. Taking smaller amount of snow versus taking big chunks of snow onto your shovel. Okay? Some strategies. So some strategies to help you get started or to maintain an exercise routine. So use a journal or a logbook. Oftentimes people find it helpful to keep track and write things down. Slot your workout into your schedule. So think of it as slotting an important meeting or appointment into your day. And then the next one is practical equipment purchases. There are a lot of fancy schmancy equipment out there available on the market. Keep it simple, keep it intuitive, keep it accessible. There are also gadgets that will help you motivate you, such as a pedometer, using a heart rate monitor. Workout attire. So pick something that is comfortable for you to wear during exercise or physical activity. If being fashionable is something that motivates you, great. Okay, consider enrolling in community classes as well. Some people prefer exercising in larger group fitness classes, whereas others prefer exercising individually. That's up to you. So most importantly, do what you enjoy most. 3 important take-home messages. Have fun, keep moving, and exercise is medicine. So this concludes the exercise and the heart talk. View other presentations for further in-depth cardiac information or consult your healthcare provider to have specific questions answered. Thank you for taking the time to view this session and for participating in Fraser Health online cardiac rehab education program.